It's time for our nursing tip of the week, and in this week's tip, we are talking about rectal tube. This is one type of rectal tube you may see. This is called the Flexoseal. It's pretty common, and this is the one that we use at my hospital. Rectal tubes can be used just as a quick insertion if you're like administering medications, or they can be used indwelling more longer term. We don't just use rectal tubes in every patient with diarrhea, but in the ICU, we will use them for patients that are having large amounts of stool output that is liquid, or if we need to administer medications. The more stool output a patient has when they're unable to actually get up and go to the restroom, it is very hard on their skin, and we can do our best to clean patients up and all that jazz, but some patients will continually go, and it just causes more risk of infection and skin breakdown on their bottom, and so that is a good reason why we would use a rectal tube. They can stay in for up to 29 days. That's a pretty long time, but it's important to note that patients must have adequate anal sphincter tone before you insert it, and you'll know if patients don't because this device will just like slip out. I thought we could talk about some of the steps for inserting the rectal tube as well as some tips and tricks that I have. First and foremost, before you put the rectal tube in, make sure that you have a lot of lube and that you actually connect the tube, the rectal tube, to the bag in case you get a large poop explosion that comes out. It doesn't start leaking everywhere. I know from experience. You're gonna insert your finger into the balloon. It's going to be deflated, and I also will have my syringe already drawn up to about 45 milliliters and hooked up to the port where you inflate the balloon. You'll use lots of lube, and you'll place your patient in left lying Sims position, and you'll go ahead and insert it. Now, you wanna insert it a couple inches up there, like they say like 6 inches. My fingers aren't 6 inches, so I kind of push it and have to kind of like advance it up in there. Once it's inserted, you're gonna inflate the balloon, and you do not wanna use any more than 45 milliliters of water. Once this little green thing starts to pop up, you're probably good. If the red one starts to pop up, you wanna stop and don't use more than 45 milliliters of water. I see so many nurses overinflate the balloon, and it can either pop the balloon or you're just gonna cause like rectal leakage around the rectal tube. It will not conform to the rectum as well and does not work as well. And that's one of my tips. If it's leaking, a lot of nurses think insert more water, but a lot of times you wanna actually take some water out. Once that balloon's inflated, I'll actually kind of gently pull back down on the rectal tube so that way it is just kind of sitting up in the internal sphincter. And then I'll use the irrigation port to irrigate the stool a lot and get it kind of cleared up out of there and back into the bag. At this time, I make sure there's no leaking and that it's placed nicely, the patient's all clean. You irrigate through the blue port, you do not irrigate through this white port. Rectal tubes are kind of a blessing and a curse. When they work really well, it's amazing, and sometimes they just aren't working the best, but overall, we want to reduce the amount of stool that is on the patient's skin, and these help a lot. I know that was a super quick breakdown, but let me know if you want any more specific tips or tricks.